But first, and I did say, don't panic. Let me quickly update you on the numbers. In Italy, France and Spain, signs that the virus has peaked, taken a terrible toll though. In Australia, the trends are even more dramatic. Tragically, we have had another 4 people die in the past 24 hours. The death toll is now 40. But remember, we were warned 3 weeks ago we could have 150,000 dead. And the rate of increase has slowed to a crawl. Just 108 new cases in the past 24 hours. 108. And a third of our nearly 6,000 infections, well, they've recovered. The Deputy Chief Medical Officer for the first time suggested that the peak may now be behind us.
The peak in terms of the daily cases indeed was last week or the week before at the moment. Whether that's the final peak, I can't really say at this stage. It's speculation.
And that's all why this prediction from the Australian Medical Association 2 weeks ago was hopelessly wrong, that we'd run out of emergency beds by yesterday, in fact. The truth is, hospitals like the Austin and Victoria were instead left with lots of empty beds. And around the country, we have had a couple of thousand intensive care beds ready, but just 96 coronavirus patients using them. It does seem there's been a dramatic overreaction. Now, if the restrictions on our movement didn't cost that much, I'd say, all right, keep them going. But the cost is enormous. Hundreds of thousands of us have lost their jobs. And telling us to stay at home at all costs seems now way out of proportion. Victoria, you can't even go fishing or get a driving lesson from your mum on your L plates in these near empty streets. Here's Sherry Reynolds and her daughter Hunter fined $1,600 for being outside their home without an excuse doing a driving lesson, despite obviously posing a health risk to absolutely nobody.
I didn't think for 1 minute that we would be doing anything wrong. We weren't in contact with any person. We weren't stopping anywhere.
I was just shocked because I obviously hadn't done anything wrong, or so I thought.
But Victoria's Chief Medical Officer, Brett Sutton, decided to leave his house this weekend to walk in the Yarra Ranges and to post this lovely snap. OK, we're all allowed out for an exercise, but I thought that just meant around the block. Sutton did say he lived next to the park and walked there, and he defended himself.
Yeah, it really is all of the common sense things that we're saying. If you can stay home, please stay home. I've only gone out for those 4 reasons. So yesterday that was me exercising. I was getting out and I went for a 20-minute walk.
If you can stay at home, stay home. But the Chief Medical Officer of Victoria himself did not. Took his exercise in the mountains. Now, I don't blame him. After the way that man's been working and under such stress, I don't blame him for wanting a break in the bush. But if he thinks that a walk in the park is no threat to anybody, the state should now reopen the parks that they shut down because of the virus in Queensland and in New South Wales and also in Victoria, so that other people can distress in the bush as well, while maintaining their social distance. You see, we are starting to get right on top of this virus, and surely we're at the point, which I argued last week, where we can plan to lift some restrictions from next week, provided we first do more to protect the old and the ill and we do better quarantining of the ill. We don't have to wait these 6 months that the government said. And hallelujah, even the Deputy Chief Medical Officer of Australia today suggested, well, maybe we could now think about that after all.
The next obvious question is when the break could be released. I think we can also look at those particular measures that have been brought into play as to which are the ones that could be removed early.
I said it could be done, now it can and must be done.